Hello, class. This is Tutor Godwin. Welcome to Flourish Nursing Academy. We'll be discussing the human anatomy. Human anatomy is the study of the structure of the human body and the relationship of its constituent parts to each other. Histology, the study of tissues, including the cells, by means of a microscope. Neuroanatomy is the study of the nervous system, both by gross anatomy and microscopically. Terms of position. 1. Anatomical position. The person is standing erect, with the upper limbs by his sides and the face and palms of the hands directed forward. 2. Median sagittal plane. It is a vertical plane passing through the center of the body, dividing it into two equal halves, right and left. 3. Paramedian plane. Any plane that lies parallel to the median plane on the right or left sides. 4. Coronal planes. Vertical planes at right angles to the median plane. 5. Horizontal, transverse planes at right angles to both the median and coronal planes. 6. Median, on the midline. 7. Medial, nearer to the median plane. 8. Lateral, away from the median plane. 9. Anterior, near to the front of the body. 10. Posterior, near to the back of the body. 11. In the hand, palmar. Anterior, dorsal. Posterior. 12. In the foot, plantar. Anterior, dorsal. Posterior. 13. Proximal, near to the root of the limb. 14. Distal, far away from the root of the limb. 15. Superficial, near to the surface of the body. 16. Deep, far away from the surface of the body. 17. Superior, near to the upper end of the body. 18. Inferior, far away from the upper end of the body. Terms of movements. Joint, the site where two or more bones meet. Movements in the sagittal plane. 1. Flexion, usually approximating two anterior surfaces together, but sometimes two posterior surfaces, as in the knee joint. 2. Extension, straightening the joint and usually takes place in a posterior direction. Movements in the coronal plane. 1. Flexion, movement of the trunk or the head in the coronal plane. 2. Abduction, movement of the limb away from the midline of the body. 3. Adduction, movement of the limb toward the body. In the hand, abduction and adduction of fingers are movements away from and toward the middle finger, the axis. In the foot, abduction and adduction of fingers are movements away from and toward terms 1. Rotation, movement of a part of the body around its axis. 2. Medial rotation, anterior surface of the part faces medially. 3. Lateral rotation, anterior surface of the part faces laterally. 4. Pronation of the forearm, medial rotation of the forearm where the palm faces posteriorly. 5. Supination of the forearm, the lateral rotation of the forearm where the palm of the hand faces anteriorly. 6. Circumduction, a combination of flexion, abduction, extension, and adduction in sequence. 7. Protraction, forward movement. 8. Retraction, backward movement. 9. Inversion, movement of the foot so that the sole faces medially. 10. Aversion, movement of the foot so that the sole faces laterally. Movements of the thumb. 1. Flexion, movement of the thumb medially across the palm in the coronal plane. 2. Extension, movement of the thumb laterally away from the palm in the coronal plane. 3. Abduction, movement of the thumb anteriorly away from the palm in the sagittal plane. 4. Adduction, movement of the thumb posteriorly towards the palm in the sagittal plane. You've now learned the basics of anatomical positions and movements. Can anyone explain why this understanding is crucial in the medical field? It helps us precisely describe locations and movements during diagnosis and surgery, and it's essential for communicating with other health professionals. Miscommunication can lead to serious mistakes. Exactly. Excellent points. This precise language ensures we're all on the same page, no matter where we practice medicine. Excuse me, Tutor Godwin. May I have a moment? Certainly, Principal. Class, please continue reviewing today's notes. I wanted to express my appreciation for how you've engaged the students today. This foundational knowledge is so vital. Thank you, Principal. It's inspiring to see their enthusiasm. They're the future of healthcare, after all. Indeed, and under your guidance, I have no doubt they'll excel. Now let's summarize what we've learned before the class ends. Who can explain the concept of anatomical planes in their own words? Anatomical planes are imaginary lines that divide the body into sections, helping us understand body structure in 3 dimensions. Well said! Understanding these planes is like having a map that guides us through the body's structure. Keep studying and always ask questions.